Hi, it's Dr. Ronald Lett from the Canadian Network for International Surgery. We're on to Lecture 4 on our Expert Thinking series. After the first 3 lectures, you know what to do if a patient is low, medium, or high risk. In this lecture, we shift gears and learn how to use the patient management form, which is a tool to aid you in determining whether a patient is low, medium, or high risk. Here is the patient management form. You will notice at the bottom, it's very familiar. We have the low risk, medium risk, and high risk patient. So the objective of the patient management form is to get you to that familiar area. The low risk patient who you treat locally. The medium risk patient who you treat locally but observe closely for up to 24 hours. You assess them morning and night, and if they're not doing better, you transfer them. And then there's a high-risk patient who you resuscitate and stabilize, prepare for referral, and then you transfer them safely. So that is the end objective of the patient management form. But how does it start? It starts with identification of the patient, their age and gender, the chief complaint and duration, the physiological status of the patient group, surgical, medical, obstetrical. Do they have danger signs? Obstetrical danger signs, surgical danger signs. And then we come to the most important item on the patient management form, the preliminary diagnosis. What are the 3 most likely problems that this patient will have? And then you choose the worst case scenario and you treat them based on whether that worst case scenario is low risk, medium risk, or high risk. We're going to go through the patient management form in detail. We're going to start going line by line through the patient management form. We'll start with line 1. It is the identification of the patient. Their name will tell you something about them. Perhaps their religion, perhaps their social-economic status. These are relevant to their illness. We'll look at their age. Are they an infant, a child, a teen, an adult, or elderly? This will affect not only the diseases they might have, but their resiliency. And then gender. Men get some diseases that women don't get. Women get some diseases that men don't get. There's also a difference in distribution of the diseases between male and female. So that's all in line 1 of the patient management form. So again, we're looking line 1, right at the top. Name, age, gender. So after we've identified the patient, we know their name, we know their age, we know their gender, we move on to line 2. In line 2, we look at their chief complaint. What is their problem? Listen to the patient. Believe them. If it's a child, believe the mother. How long have they had the problem? Is it hours? Then it may be a very acute and aggressive problem. If it stays, either it's not an acute problem or it's been neglected. Same thing with weeks. If it's been going on for months, it's probably a chronic condition. So line 2 gives you this information. So here we have line 2. Chief complaint and duration. That's it. So we've just got to line 2. We have chief complaint, we've listened to the patient, we've looked at how long they've had this problem. So what we're actually doing is building up a case so we understand the patient. So with line 1 and 2 together, we are actually starting to understand what's going on with this patient. So we now move on to the patient's management form, line 3 and 4. We learn about the physiological status of the patient, their mental status. It's very important just to talk to the patient and find out what's going on. Are they alert? If they're not alert, do they respond to vocal stimulus? Do they answer your questions? If not, do they only respond to painful stimulus? And finally, are they unresponsive? So the mental status tells you about the patient. We then move on to vital signs. What's their temperature? Do they have a fever? What's their pulse? Is it slow? Is it fast? Respiratory rate. Is it slow, normal, or fast? Blood pressure. High blood pressure, low blood pressure. So when we take that, we start to have a good understanding of the overall physiological situation of our patient. So here you see on the patient management form, we have the mental status with the choice of alert, responds to verbal stimulus, responds to painful stimulus, or unresponsive. We have the vital signs, their temperature, heart rate, respiratory rate, blood pressure. So we're progressing. We're starting to get a good understanding of their physiological situation. The patient management form, now we have their name, their age, their gender, their chief complaint, their duration, and their physiological situation. We are really starting to pull it together and really understand this patient. We move on to line 5. With all this information we have on the patient, we can start to understand what group do they belong to. Are they infectious disease? They come in with a fever. Are they medical or chronic? Their blood pressure is up. They've had this problem for months or years. Is this a surgical problem that they've never had before? Is this obstetrical? In a pregnancy or postpartum obstetrical problem? So now we can get even further on in the management and understanding of this patient. So you can see, after we understand the patient better, we can group them. And on the patient management form, we have the infectious, chronic, and other medical diseases here, the surgical problems, and the obstetrical problems both during pregnancy and postpartum. So we have made decisions about the patient's situation. Are they infectious, medical, surgical, obstetrical? All this information is now on the patient management form. We've got their name, their age, their gender, their chief complaint, their physiological status, and their patient group. So with this information, all this information, we're getting to a position of treating the patients. The infectious and medical patients we should be able to treat. This is not part of this course, but this will be very much a part of your life as a frontline health worker. You will be able to identify those surgical patients and look for danger signs, and those obstetrical patients and also look for danger signs. So before we go on, let's just look at the infectious, chronic, and other medical problems. You'll be treating them with antibiotics, antihelminthics, analgesics, and hormones, and you'll be doing a lot of good care. For the surgical patient, you need to check and see if there are any signs of danger to their life. Do they have low blood pressure? Do they have a very high heart rate or pulse rate? Are they breathing very quickly? Are they using the muscles in their neck to try and breathe? Is their mental status going down? They were alert and now they're only responding to stimulus like pain. Or are they even becoming unresponsive? In the case of burns, is more than 10% of their body surface area involved? If the abdomen's distended and tender, that's a concern. If the abdomen's distended and they have a high fever, again, this is a concern. Penetrating wounds, especially to the head, chest, and abdomen, are a problem. the pulseless painful limb is of concern. So we have a whole series of surgical danger signs that we need to look for. So you can see on the patient management pane, if they have a surgical problem, then you go over to this side and you look for those surgical danger signs. Low blood pressure, high heart rate, shortness of breath, mental status that's going down, large burn, distended abdomen with pain, distended abdomen with high fever, penetrating rheums, pulseless painful limbs. In the case of obstetrics, are there obstetrical danger signs? A previous cesarean section, multiple gestational pregnancy, twins, fever after birth, before or after delivery, low blood pressure, severe headache, high blood pressure, profuse vaginal bleeding, during delivery. Are they dilating at least a centimeter every 4 hours in active labor? If not, things are not progressing and you need to think about getting help. Is the fetal heart rate less than 100? Is the fetal heart rate greater than 160? Is there meconium staining? Any of these obstetrical danger signs makes you think that you might want to refer or get this patient delivered quickly. So here we are back at the patient management form. The patient's in obstetrics. Therefore, we look for obstetrical danger signs. Previous cesarean section, multiple gestations, fever after delivery, low blood pressure, severe headache, high blood pressure, profuse vaginal bleeding during delivery. Is the cervix dilating at least a centimeter every 4 hours in active labor? Is the fetal heart rate slow, less than 100? Is it fast, greater than 160? Is there meconium staining? All of these signs are something that should be of great concern. So here we are at the patient management form. We've accumulated a lot of information and a lot of understanding of the patient. And that's how you make expert decisions, by understanding the patient. We've identified the patient, we know their chief complaint, we know their physiological status, we know their patient group, we've looked for danger signs. So at this point, we come to a crucial part of the patient management form, the part that leads us to making that diagnosis or determination of low, medium, or high risk. We make a preliminary diagnosis. You recall earlier I said that diagnosis isn't crucial. I still believe that, but it's not like we have to have the right diagnosis, but we need to be in the ballpark. We need to have some understanding. So what are the 3 most likely diagnoses you have? The first diagnosis, is it low, medium, or high? The second most likely diagnosis, is it low, medium, or high? The third likely diagnosis, low, medium, or high. The preliminary diagnosis is important. You do not want to rush to conclusions. That's just laziness and will lead to serious mistakes. Consider the 3 most likely diagnoses rather than just jumping on the easiest thing that comes to mind. These 3 will help you decide what is in the patient's risk and what action you should take. Define the risk based on the patient's most serious choice. For example, if 3 cases of abdominal pain could be gastroenteritis, urinary tract infection, or appendicitis, you manage with the most serious choice, not the other choices. So, in this case, you would observe for appendicitis and refer if the patient does not get better. If there are any danger signs, it is at least medium and possibly high. So your preliminary diagnosis helps you decide what is the worst case scenario and whether this is a low risk or medium risk or high risk patient. So here we are back at the patient management form. We are making 3 preliminary diagnoses, the 3 most likely. This is crucial. Not rare ones, not unlikely, the 3 most likely. We have completed the patient management form. We've looked at their name, their chief complaint, their physiological status, their patient group. We've observed for danger signs, and then we've chosen the 3 most likely diagnoses. We are now on to low risk, to treat locally, medium risk, to observe, and if they're not better in 24 hours in the surgical patient or 12 hours in the obstetrical patient, you refer them. And the high risk, resuscitate, stabilize, and prepare for safe transfer. In summary, the patient management form is an aid to help you make expert decisions. It helps you decide whether a patient is low risk, requiring care here, medium risk, requiring care plus careful attention, or high risk, requiring resuscitation and referral. You are the frontline health workers, the patient access point to the healthcare system. Clinical officers, health officers, midwives, health extension workers. You're crucial. The first task of community health workers, that means you, is to determine which patients require early referral, which will benefit from local treatment, and which may require referral if your treatment fails. Patient management form is designed to help you reach that decision. Understand patient risk and decide among the 3 choices for all patients: local treatment, observation with potential referral, resuscitation and referral. So this is it. Here's the patient management form. In our courses, you'll be practicing with this form. You'll be doing exercises to see if on simulated patients you can come up with good decisions on whether they're low, medium, or high risk patients. I would hope you'd use this ideology and this methodology in your future career so that every patient you have, you know their ID, you know their chief complaint, you know their physiological status, you've grouped them, you've checked for danger signs, you've made a preliminary diagnosis 3 times, and you have then categorized their risk and behaved appropriately concerning their risk. So this is how you will have a future as an expert thinker, and your patients will benefit. So you've come to the conclusion of the lecture 4 on our expert thinking series. We do have one more lecture or exercise which will help you practice using the patient management form with case studies. So review lecture 1 to 4 and prepare for practicing on simulated patients, and then in the future, use this methodology on real patients.